Greetings, friends and followers. This is Nurses Talking. I am Del Barzi. As always, if you like what you see and hear, subscribe. Leave us a comment and let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today I'm very, very pleased to welcome Unsha Bakker. Unsha is in New York, USA. She's a registered nurse, she's an educator, a mental health advocate, and a certified oncology nurse. So, welcome, Unsha.
Thank you so much for having me. I'm so excited to be speaking with you today.
Well, thank you for doing this because I really do appreciate it. I love talking to nurses and seeing what we're doing in this planet, in this world. We're doing huge things. So,
No, I completely agree. I think there's like so much to talk about, and we really
yeah.
need spaces like this to just really get our thoughts out, our feelings, and just kind of collaborate with each other.
Absolutely, absolutely. And thanks to Zoom, we can do
Yes,
it.
exactly.
So, but firstly, what made you become a nurse?
So, from a young age, I actually always witnessed my brother being taken care of because he had a chronic illness. He had spinal muscular atrophy
Oh,
from birth. So, witnessing all of the care that he received and everything that he really needed throughout the course of his life really exposed me to medicine from a super early age to the
mm-hmm,
point where I really knew I was really great at nurturing, being a caretaker, and also just being very empathetic. So I do feel like that's kind of how I fell into medicine, specifically within nursing. I really
mm-hmm,
know that it was a lot of the nurses that had really helped my brother and really been at the bedside for like so many monumental moments. So
mm-hmm.
that's where I also decided, okay, maybe one day I could pursue nursing. And then it kind of just happened. And now, fast forward, I've been a nurse for almost a decade.
You mean you blinked and here you are?
Yes, I blink and now I'm like, wait, I'm not a new grad. I'm one of the senior people on like the seniority list now sometimes, depending
Mhm.
where I work. And I'm like, wow, when did that happen?
Yeah, I know what you mean. I know what you mean. But here's the question I have though. Sometimes I know that you closely observe because this was for a long time during your life, but sometimes observing something and actually doing it are completely different things. So when you got to be a nurse, was it what you thought?
Honestly, no, it was very different. I was told by a lot of different people who were not nurses or not in the healthcare field, like, oh, I don't know, like, are you sure you want to do nursing? Like, why don't you want to be a doctor? Or, nurses are really kind of like the assistants, or they're kind of on the sidelines. Like, don't you want to be the one calling the shots? And now that I've actually been a nurse for so long, I see how different that perception really is versus what I
Yes.
actually do. I have been the one to call a lot of the shots. I've been so autonomous. I've had to really be there for my patients, for myself, for my colleagues, and independently really be able to think and, follow so many different guidelines and, evidence-based practice, all
Yeah.
based off of what I was reading and seeing and learning. And also, I just think a lot of people might not know that nurses wear so many hats. I mean, I did not know how many things I would be doing that are just not on that basic job description. And,
Yeah.
there's a lot of things that I've been doing that I'm so grateful to have done for people and like what I've learned. There's just no way to kind of explain it unless I know like people have been a nurse themselves. It goes beyond just I know like what the perception is on the outside, like, oh, you're with your patients during the day. It is so deep, so layered. And yeah, it honestly, and I will say it's not for everybody. It's not for everybody. And I know I've been doing this for quite a long time because I really do value like the relationship I have with my patients at the end of the
Yeah.
day and really being able to be there for them. But again, it's like not something that I would have known, on that day one of nursing
Yeah.
at all.
Yeah, absolutely, absolutely. And you so very eloquently articulated one of the goals of this channel, because I really, really want people to see, expand their view of who nurses are. The people that we serve have no idea who we are.
Yeah. Yeah. And
And
it's a shame.
yeah, it's a shame. But the thing is, unless we tell them, they're never going to know.
Yes, this is true. This is why I think having these kind of platforms to really just talk and elaborate on what nurses really represent is
Yeah.
so important. And I think there's definitely been a shift coming about. So I would say like maybe during the pandemic, I saw that shift coming about where people really were starting to see
Yeah.
what nurses really mean in healthcare and like how we there are so many times where we are the front line of care. And this is not to put any other field down like within healthcare, because I really think every single person is so important to getting
Hmm.
like help for the patient, and it's really like a total amount of care. However, yeah, I just think there's so many aspects where I've seen nurses be like undermined or just kind of like pushed to the
Push to the
side.
side. Hmm.
Even when making decisions that impact us individually as nurses, I've noticed, we're not in that
We don't
conversation,
think
or
yeah,
like
yeah.
we're not there, we're nowhere to be found, but all these decisions affect us and impact us daily. They impact how we give
Yeah.
our care to people, how we give our care to ourselves, our colleagues. And honestly, like we could talk about this for so much longer. Like if we could talk
Yeah.
about this for days,
So
because it is just so prevalent.
it is prevalent. It is prevalent. I say that, we allow, and we're allowing it too. We've been conditioned to allow
Yes.
this, and we allow people to treat us the way perhaps parents treat 2-year-olds. You make the decisions for the 2-year-old. And we've
Yeah.
got to realize that we are grown up. We have
Yeah.
grown up, and we
Yeah.
will insist on making decisions that affect us.
Yes, I agree. I think there is that aspect of where so many things have been pushed on us, but it is definitely time to speak up and like take up that space, because, we are so important. And I think individually, unless we realize that and we're able to take up that space, changes just aren't going to be made. And of
Yeah.
course, it's so layered. There's so many aspects of this. Like, I'm not trying to put the blame completely on, healthcare workers. I know we go through so much. There's so much to be talked about. However, it's true. We need to start opening up about
Yeah.
what we actually go through, about what we actually see, and about what we actually need.
Yeah. Well, yeah. Yeah.
There's just so many professions I'm realizing where there are certain standards that, you cannot perform your job unless these standards are met. Like let's say everything that's going on with like airlines, right? With like staffing, with
Hmm.
hours of pay or hours worked. I mean, they will not let you technically like fly a plane if
We
X,
will
Y
not.
is not met.
Hmm.
However, within healthcare or nursing, I mean, if you have a short staff day, the day goes on. They just, expect you to compensate and
Hmm. Hmm.
make it work. However, it's very important for us to, have these laws in place of like ratios of like what our real needs are. And again, this is all for the safety of our patient at the end of the day, and like the safety for our nurses. It's
Hmm.
not like just, willy-nilly, oh, I feel like the ratio should be less because, I don't really want to do extra amount of work. Like, no, there have been proven cases multiple times across the nation, globally, of so many events that just do not go favorably because the nurse
Yeah.
does not have what they need to
Hmm.
provide responsible and safe
Yeah.
care.
Yeah. Exactly. Exactly. And at the end of the day, when this comes to the forefront, you find yourself standing alone.
Yes. Yes, because
Yeah.
I have noticed oftentimes there have been a lot of people, I've been reading about just globally who have decided to speak up about things and just really shed a light on what is really happening. And oftentimes those are the people that are kind of the outcasts,
Yeah.
or like, oh, why is everyone leaving bedside?
Yeah. You're not a team player.
Yes, yes. Meanwhile, you are a team player if you are expressing the needs of safer care. So
Mm-hmm.
it's also that mindset shift of, what are we really prioritizing here? And,
Mm-hmm.
I do think that shift is coming and people are, you know, discussing more and being more open to it, especially since the pandemic. I think generationally there have been like
Yeah.
shifts coming. When I speak to nurses who are not in my generation, who are in the younger generations, oftentimes they will not stand for so many things that like we've all accepted throughout the years, and it's great because they're really paving the way for safer care and
Yeah.
better self-care for themselves as well.
Yeah, yeah. As you articulated that, I'm really happy to see that happening. And, I can't wait to see it. I want to see these nurses just stand up and take the power back because you have it. You have
Yes,
it.
yes,
Yeah. So you specializing in oncology.
yes.
Why?
So honestly, I fell into oncology randomly. It was just I was applying for jobs as a new grad. The one place that had gotten back to me, and I liked them, they liked me. It ended up being an oncology med surge unit, so I accepted the position. Honestly, before I had started my nursing career, oncology was not one of the places that I
Hmm.
expected to be in. To me, originally, I mean, it still can be very sad, but originally I was thinking there's just no way I will ever survive in that environment to like see people diagnosed with cancer every day. I just don't know how I can do that. But when I had accepted that job and I stayed there and I learned about oncology and my patients, like 10 years later now, I'm still in oncology, and I like have not stepped outside of that field, outside of that specialty at all, because I found myself just loving the patient population, just learning so much from people from all walks of life. And, there's just something very different about, unfortunately, receiving a cancer diagnosis that really changes people and really, makes them extremely self aware and kind of present in many ways, because, you have to kind of address like, this is the reality of my situation right now. What is it going to look like for my future, for my family's future, my friends and family? And I've just learned so much from all of my patients throughout the years. And yeah, it's been very rewarding as well.
Yeah, yeah, yeah. I can see that. My experience with oncology has been very brief, so I don't know that I can speak to that, but I do remember being impacted very forcefully by one particular patient who makes which makes what you say about being very present and assessing themselves and stuff very, very real. Yeah.
Yes, I found that when learning about my patients every day, there's just something that I can always take home every single day that I can reflect on and really be grateful for. And, well, it's my patients that are teaching me all these things. And it's not like they're saying something to me directly, even about, what I'm learning or reflecting on. It's just their actions or their ways of life. And seeing them throughout one of their most vulnerable moments and really seeing that they're able to put their walls down and really get comfortable with me and like my colleagues. It's very heartwarming, because
Hmm.
sometimes you see these patients way more hours than you're going to see your own friends and family, and the same goes for them. So
Yeah,
it
yeah,
just like taught me so much about life, and honestly not to take things too seriously, and just knowing that life is short. Every
yeah,
day, I try to just bring joy into my life and try to really focus on that, because our days are unfortunately limited and numbered.
yeah, yeah, yeah. They are limited, and you have to fully live them, fully live
Yes,
them, and it's a good thing to come to that realization at an early stage in your life.
yes, yes. I agree with that. And I think a lot of times, unfortunately, people will realize a little too late or
Yeah,
later than they wish they would have. So that
yeah.
was definitely one of the biggest regrets that I did not want to have, like growing
Hmm.
up. And especially with everything that I witnessed with my brother, I feel
Yeah,
like from an early age, I realized, tomorrow is not promised or guaranteed. So I never want to, be in that position where I'm looking back and I'm like, oh, I wish I said that to someone. I wish I did that. And, as much as you can. Of course, there's some things you're just not going to be able to control, but for the most part, like I think living intentionally, that is really something I've learned from being a nurse.
Mm-hmm. Yeah, yeah, that's one of the big things it teaches you. Absolutely, absolutely. What would you say is your well, we talked a little bit about it. I'll go back to this, but you talked a little bit about it. But what specifically, if anything, you're an educator, and you're an advocate, you're a mental health advocate. Well, now that I mentioned mental health advocates, I'm going to go back to another question. Why that?
With mental health, I feel as though mental health has been something that's been intertwined in my life since I was very young. I witnessed people in my family, friends, just around in my life, battling with depression, with anxiety, with so many things that can come just from being a part of an immigrant family, from being a woman of color. There's just so much that I've witnessed and experienced, and just even just things that are happening in the world. And I've noticed from an early age that everyone would be kind of suffering through these things, but not talking about it.
Yeah,
And then when I began to experience my own mental health challenges, that's when things really came at a crossroads where I had to evaluate, am I going to be someone who also doesn't talk about these things? Or am I going to suffer silently? And I feel as though once I became more open with people around me about the challenges that I'm going through, about the help that I can receive or that others can receive, I've noticed people just becoming more closer, more deep, more open with themselves, more comfortable. And I've just been really passionate about it ever since having that realization. I really just enjoy talking to people really about their feelings, which is honestly what I do as a living as a nurse. Also, they don't tell you you're kind of like an unlicensed therapist when you
yeah,
are sometimes. So yeah, it's just been a journey. And the reason that I feel like I'm an advocate as well is to break down these barriers. I don't want, a world where everyone is just feeling similarly and not connecting about it. I think especially after the pandemic, I realized so many people are going through so many of the same challenges, maybe in different levels, different layers, but I know that everyone, feels happiness or they feel pain. They feel things. I think,
yeah.
it's a fact that everyone has feelings. Maybe they're just not expressing it the same way, but everyone is going through
Everyone
something.
has feelings. Yeah,
Yeah, everyone is going through something. And that just made me feel not alone. It made me feel very less alone. And I realized, oh, if I'm feeling all these things, I wonder how my friends are feeling, how my family is feeling, how my
yeah,
partner is
yeah.
feeling.
Yeah,
Yeah.
yeah, yeah, yeah. We tend to treat mental illness, as though it's like you isolated on this road all by yourself,
Yeah.
and that's not what it is. I mean, mental health is is health. Basically, it's health, and there are all kinds of levels where you are on any given day,
Yeah.
just like anything else.
Yes, I
Yeah,
always found it interesting that even as a healthcare worker, I'm always out here trying to teach people about, okay, like diabetic prevention. We want to maintain your hemoglobin A1C levels. We want to maintain your sugar intake, but there is such limited dialogue on, oh, how are you feeling yesterday? What are the stressors in your life?
yeah,
What do your relationships look like? What do you think this is coming from? And oftentimes, those are such huge factors in our health and our overall well being. And this is also why I really enjoy having these conversations because I think
yeah.
people still need to hear this. Like, it is so important to be preventative for your mental health, just as it would be for anything else. If it's that analogy that I feel like I often hear, if you had an arm that, got broken, you would immediately go and get a cast.
Indeed, you would.
But oftentimes I know I read a statistic somewhere where I think people have mental health care about like 11 years delayed, at least on average in America. And I mean, that's an alarming statistic considering, we just mentioned the
Yeah,
cast arm. You
yeah,
wouldn't have
yeah.
to wait 11 years to, you know,
To fix your arm, to fix
yeah,
your arm. Yeah,
no,
yeah. Very recently, I've started thinking about it like drinking water. And if you don't want to become dehydrated, then you drink. And we all know that we need to drink. And in the same way, I think we all need to know that we need to fill our water, our mental water.
yeah.
Uh, you
Yeah,
know,
so true. I mean, it's even like flowers. I am sitting in front of like one of my flowers right now, and I see what happens when we don't water it.
yeah.
And it's like, we're humans and we function just like nature and everything around us. So,
Exactly, exactly, exactly. And all of us, we talk about holistic thing, looking at people holistically. We gotta make sure all of us is watered, all in all areas.
yes, I completely agree.
Mhm. As an educator, now you okay, so from your perspective, you're a senior nurse now, 10 years in. Right? From my perspective, I'm 40 something years in. So I'm not gonna call you a young nurse, but you're recent enough and graduated recently enough and has enough recent experience to be able to look back and say, what would I have liked to learn? What would I have liked to be included in my nursing education? What would you like to see included?
I really would like to see mental health included and just how to have difficult conversations with either colleagues or your patients and really have that aspect of communication be included, because I feel as though there's a lot that you kind of just learn as you go along, which is great because I think nurses are such smart individuals. We go through all of this training and even in-person training, and you kind of have to roll with the punches. But I think just having that be inclusive would be so important. And also just seeing a diversity of thoughts and different people that you're able to meet. I would love to see leadership be more diverse. I would love to see all of our classrooms be more diverse. I would love to see just the status of healthcare changing in that aspect.
Exactly, exactly, exactly. What would you say is your greatest achievement so far?
That's tough because I really have to think and be able to compliment myself and say like, what is the greatest thing? I think one of the most important things is to not have let everything that I've gone through impact me in a negative way
Mhm.
to the point where I've kind of become hardened
Yeah,
across my patients or my colleagues. So,
yeah.
what is very important that I take back as an accomplishment is the ability to be able to have, not coming from a background where anyone in my family was in healthcare to being this, independent woman of color, like coming from a first generation family of immigrants to really being able to be a resource for other nurses, to be able to communicate, to be able to still
Mhm.
have that passion and give back to my patients. So I'm really proud that after everything I've even personally been through or witnessed within healthcare, within nursing, within everything that's happening globally all the time, like I'm still able to really give back to my patients and see them as an individual human, and also to not take things personally, to really just know someone's going through a hard time, and I've
Yeah.
also been in their shoes sometimes from like the healthcare and patient aspect. So I really am proud of myself for bringing in like my best foot forward even through all the challenges, and having that resiliency, but
Yeah.
also knowing when to take a step back, knowing how to debrief for myself, having my self-care practices. I would say I'm just so proud of that.
Good, 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 good. Awesome. I love it. And I typically ask that question because we tend to work so much, we tend to get involved so much that we don't take any time. We often just overlook what we do or what we have achieved or how we have impacted someone as just another thing. But it
Yes.
isn't just another thing. It's something that we really need to sometimes take, give ourselves a little pat on the back for, I
Yes.
think.
No, thank you for bringing that up. I think it's really important for everyone to be able to like look back and see like how far they've come,
Yeah,
because we're evolving every day, and there's just always something that I think we can do better, and we are trying. And I think
yeah,
that's really important, the aspect of trying and being
yeah.
aware.
And assessing. Yes, indeed. Yes, indeed. Early on, you said, when you were talking about what brought you into nursing, you said it's not for everyone. What advice would you give to someone who wants to be a nurse?
I would say for people who are looking into healthcare and looking into nursing, there is such a huge aspect of, you really can do so many different things. It is not a limiting career in the sense that you might only have to work with one patient population or only work in a certain
Yeah,
industry. There's just so much change happening, especially in the next few years. There is the merge coming into health in technology.
yeah, yeah,
So there's just so much that's happening. So in that sense, that is a great piece of advice I would give. I would also say that, it is what you make of it as well. There's going to be a lot of challenges and hardships, but it is up to you to know what you need to prioritize for yourself. And really having that self-care, I would say, is so important with your boundaries, with what you really know that you're looking for to get out of your career. I would say don't let other people dictate what kind of nurse you're going to be, with the kind of care that you're going to give. And, this is not to say not to be open to feedback. I'm just saying it is very important to really try to know who you are as you go into this. If you're there to truly help people and really see them, through a hard time, you will be successful. And this is not to say you won't have the challenges that I mentioned before.
yeah,
There's
yeah,
so much happening in healthcare. There's things that are out of our control. I understand why so many people end up getting burnt out. I truly
yeah,
understand.
yeah, yeah,
And to that, I also say, if you're feeling burnt out, I think you're self-aware, and, you can pivot into something else within nursing. It is okay to just switch things around. I would say don't stay somewhere for too long to the point where you don't enjoy it anymore, because
yeah.
this can still be enjoyable. Just it might require some changes on your
Yeah.
end.
Yeah, yeah, because you know what, as we grow, and that's one thing about this career, it makes you grow. And as we grow, things within us change, and externally things are changing. And so what fit you 5 years ago may not fit you
Yeah.
today, but there is a niche for you. There is a place for you to go
Yes. And I think it's
without
all about,
abandoning it. Mhm.
yeah, I think it's all about finding it, about exploring, about expanding. I would say even a few years ago, nurses were not on LinkedIn. It was just
Yeah,
not an expectation. You just apply through different methods, but LinkedIn was not really one of them for connecting. And, that's even how you and I connected. And I think it's
exactly.
so great to keep talking to different people, and you'll just find opportunities if you're looking. It's not going to be easy necessarily, but it's
It's
happening. And I
there.
think, yeah, that change is occurring.
It's there. It's there. A couple of times you mentioned self-care.
Yes.
What does it mean to you, and what do you do to care for you?
For me, self-care it can look like anything from the my basic needs of, eating properly, getting sleep, getting sunlight, to even more layered things such as, oh, I had a really difficult moment this week. I need to journal about it. I need to talk to people about it. I need to go to therapy about it. I, just need to
Mm,
do something for myself. I think oftentimes healthcare workers are put in a position where, you have to keep on going, even when you're running on empty. You have no fuel. And that's even one of the things I've taught nursing students that I've precepted. I'm just like, I understand it's really busy right now, but if you feel like you need to have a water break, you need to go to the bathroom, you need to eat, that is important. It is just as important as you taking care of someone else. And, just even logically, when I think about it, if I was a patient and I heard that my nurse hadn't eaten in 12 hours, I wouldn't even feel safe for them taking care of me. And I would feel bad. I mean, like, I don't want to be taken care of by someone who doesn't have time to do these things for themselves. It's also
Exactly.
almost hypocritical. I tell all these people to hydrate and drink water, eat vegetables, but then if I'm not doing that for myself, I'm not
Yeah,
even staying on brand for myself.
exactly. Exactly the point. We're accepting things for ourselves that you would never, never, never accept for your patient.
Yes, yes. And I think it just goes to show it's even, when you're talking to a friend, if they're venting to you about something, and you would never give them the same advice probably that you would give yourself, like if you're speaking negatively to yourself.
Yeah,
I would
yeah,
never tell my friend, "Oh, you worked for 12 hours. Can you please work another 6 hours because, no one
yeah,
else is coming into work?" I would be like, "Oh my gosh,
yeah.
please, you need to get rest,
You
like
need to
make
go
sure
home.
you take the next day off." Yeah. I'd say even making sure I take my PTO. I think that's an
Yeah,
underrated form of self-care. It is there for our benefit. And, of course, in a privileged way, I am able to take the PTO for self-care. There's so many people who just can't. They don't
yeah,
get enough PTO, or they need to use it for family emergencies
yeah.
or personal things. But, just taking that physical time away from work is so healthy, because at the end of the day, like, this is not my whole identity. I'm such a proud nurse, but there's so many other things about me that I
Yeah,
appreciate, that I'm proud of. And, nursing is one great aspect of my life, but it's not all of me at the end
it's
of the
not
day.
all of it. Not all of it. Not by any means. Not all
Yeah.
of it.
Yes.
And you know what? The thing is that the longer in my view anyway, the longer that you're a nurse, the more you become aware of what your other facets are.
Yes. Yes. I think when I had first started, it was just nursing was my whole identity. And now, as I'm just gaining more insight about myself, about who I really am, about, what I want to be in this world, and like what kind of legacy I want to leave behind, and that intentional living that I was
Yeah,
mentioning before, I'm thinking, yeah, nursing is not 100% of this. It is such a great aspect, but, it makes me who I am, but it is not the only thing that's driving me to live intentionally.
exactly, exactly, exactly. Before we go, Unsha, is there any last word you'd like to leave us with?
I would like to say just thank you so much for having me in this space. And I just think it's really, really great what you're doing, hearing so many diverse minds and trains of thought. And I'm just so happy that you reached out and that you feel comfortable, talking to so many different people and gaining different perspectives. I think this is how we're going to create change. And I see great things moving forward.
Thank you so very much for saying that. Thank you very much indeed.